live palpation, the finger pads of the dominant hand are placed on the surface of the area examined. And see where are the fingers, the tip of the fingers? See it right there? So we said the finger pads of the dominant hand are placed on the surface of the area to be examined. This is for live palpation. The hand is moved slowly and the finger pads at a depth of about 1 centimeter or 0.39 inches and form circles on the skin during assessment. As you can see it in here, you always begin with light palpation, and see how they use the pad of the fingers. And once they place those fingers, they just make circles with the hand on the area that it is being assessed or palpated. And it is applied pressure, but very light pressure, like 1 centimeter. Not deep, going all the way down. That is called deep palpation. Deep palpation is used to palpate the abdomen and organs that lie deep within a body cavity and when overlying musculature is thick, tense, or rigid, such as in obesity or with abdominal guarding. Deep palpation is performed at a depth of 2 centimeters to 4 centimeters, about 0.75 or inches to 1.5 inches. However, deep palpation is used for organs. Usually, my questions will come like whenever there are pictures, and then I have the writing in here. But deep palpation is used for organs that lie deep within a body cavity. Fingers of the dominant hand for added pressure and use with great caution. And why, we will see in a minute, but I just want you to notice the difference between deep palpation, and the other one when it is light palpation. Light palpation, remember, only one hand and only 1 centimeter pressure. Deep palpation, one hand and then on top of that hand, the other one for more added pressure. And you use 2 centimeters pressure down. However, most nurses do not do this. It is almost contraindicated in real life too. Unless you are a nurse practitioner, which means you have an advanced degree in nursing. Deep palpation is contraindicated because deep palpation is contraindicated if one suspects that the rigidity, let's say that this you are assessing the abdomen and you find the abdomen very rigid, is caused by inflammation or alterations in underlying organs and structures due to conditions such as dissective aneurysms. These are even to begin with, this dissecting aneurysms, even without any palpation, whether it is light or deep palpation, most patients end up dying because it's the aneurysms is like bleeding of arteries that you cannot control it. Most patients die for dissecting aneurysms. Whenever the patient has died, most patients die. But if you suspect that the patient has dissecting aneurysm, peritonitis, or ectopic pregnancy, you should never do deep palpation. It is contraindicated. These are some additional conditions when performing palpation. You always explain the procedure. Mr. Smith, I'm going to apply my fingers there. Remember, you cannot use medical term unless you know that your patient is a doctor or a nurse, or anyone related to the medical field. Because then, of course, they understand the medical terminology. They understand palpation. But you can just say, I'm going to be feeling your stomach, or I will be feeling your chest, or whatever you are palpating. You explain the procedure, you help the patient relax and promote comfort by keeping the patient warm. That is the reason why when you go to nursing, they will ask you to cut your nails. If you have long nails, they will ask you whenever you go to the. I think you have already gone to the Sims lab, right? Before you go in, you get inspected, and they ask you to show your nails, your hands, and if they are long, they will ask you to go and cut at them. If they are, you have nail polish, they will ask you to remove it and things of that nature. The reason why they are so strict on that is because if you have long nails, whenever you are palpating the patient, you harm the patient. You harm the patient with your nails. Same thing if you're wearing a lot of jewelry, like especially your ring, your 1 carat diamond ring. Sometimes it turns down the ring, and you can hurt also the patient. So that is the reason. And not only that, you could even lose it. It is okay to have a band. Like if you are married, you have a band, and that does not, even if it touches the patient, it doesn't hurt the patient. But if you have like a diamond ring and things like that, if it moves, when you are palpating, it will harm the patient. So you should avoid wearing jewelry. Non-sterile gloves should be used if open skin areas or drainage were noted during inspection. However, nowadays, because of the COVID, it is always required that you use non-sterile gloves whenever you are doing this physical assessment. Normally, you know that you use, because of universal precautions, you use non-sterile gloves only if you notice that there is any drainage, right? Or blood or anything. You are expected to use that because of universal precautions. Whenever you are doing a physical assessment, you do not need to wear gloves normally, but right now, because of COVID, we are um, required to wear gloves when doing the physical assessment. Percussion. This is one of the techniques that nurses. You already know that when you graduate, when you complete your program, your nursing program, you will be a candidate to take the national test, which is the NCLEX. Once you pass your NCLEX, you will receive your license. When you receive your license, you will be hired as a generalist, which means you are a nurse that do not have any specialization. Hospitals will, right now, there's a huge demand for nurses. So they will ask you whether you have a preference for any type of nursing. Some of you might want to go into pediatrics, one of you OB, critical care, or cardiology, or become work in the ED. So whichever specialty you want to, you will have to take a special training, and then after that you will be eligible to take a and like, for instance, if you want to work in ICU or critical care, you will you can add to your title RN or CCRN, which means critical care, and so, but you have to have those training. So I was mentioning, the reason why I mentioned that specialties is because percussion, when you graduate and you don't work in any specialty area like critical care, um, CCU, ICU, ED, or trauma, you normally, as a generalist, do not percuss, do not use the technique of percussion. That doesn't mean that you cannot do it, but normally, usually, the nurses do not do it. But if you do it, nothing wrong with it. More power to you. So percussion is the third technique used by the nurse to obtain illicit data when performing physical assessment. Therefore, the nurse strikes through the body part with an object or the fingers or a reflex hammer, ultimately producing measurable sounds. So when you percuss, what you are trying to obtain is to elicit some type of sound that it is expected in some diseases and it is not expected in another normally. And there are three methods of percussion that can be used. No direct percussion, and no blunt percussion. So there are three methods. So again, for your skills validation, you are not. If you do percussion, fine. If you don't do percussion, it will be fine too. Because remember, it is not expected as a generalist to do this technique. However, if you do it, you won't be marked wrong. But for purpose of the exam, you need to know that there are three methods of direct percussion: blunt percussion and indirect percussion. Got it? Okay. So direct percussion is the technique of tapping the body with the fingertips of the dominant hand. Direct percussion is used to examine the thorax of an infant and to assess the sinuses of an adult. And in here, there is the direct percussion. This you will have to do it. Direct percussion, you will, because how will you know whether these sinuses are filled? And when they are filled, they are very painful. It will hurt whenever you even just tapping. See how they are doing areas, and that will be the sinuses. Blunt percussion involves placing the palm of the non-dominant hand flat against the body surface and striking the non-dominant hand with the dominant hand with a closed fist to deliver a blow. And when you read it, it sounds really complicated. But when you see it, you will see that it is very easy to do. This method is used for assessing pain and tenderness in the gallbladder, liver, and kidneys. Know this. See, this blunt percussion, place a palm of non-dominant hand against the surface and strike it with the closed fist dominant. So in here, this examiner is trying to find out whether there is pain in the kidneys. The kidneys are below the 12th rib. See, almost at the end of the ribs. You place one hand, and with your other hand, you strike your own hand, and you won't feel pain. The patient shouldn't feel pain. Both of you should feel the pressure only of the blow, but neither one of you should feel pain. Of course, if the patient feels pain, that means that there is a problem there. Maybe the patient has kidney disease, kidney stones rather. And so no blunt percussion and direct percussion. Indirect, I guess you need to know indirect too. Indirect percussion is a technique most commonly used because it produces sounds that are clearer and more easily interpreted. A hammer or tapping finger used to strike an object is called a plexor, and a plexometer refers to the device and accepts the tap blow from the hammer. Again, this is nice to know. When I said it's nice to know, that means you are not going to be tested on that type of explanation. But you have to understand how indirect percussion it's done, and how what is that you want to obtain. And indirect percussion is used because it produces sounds that are clearer and more easily interpreted. And here you see it, the indirect percussion. And how you do it is you place one of your hand that it is the dominant hand on the object or the area that you are going to percuss. In there, it seems like they are percussing the valves. And so see how the fingers of the hand that it is placed in the chest are up. The only thing that is down is the one that it is called the plexor. And so therefore, with your on it, and it will produce a sound. I'm sure you are hearing, I'm doing it now, and you probably are hearing some type of sound. And that's what is that you are trying to obtain, to elicit some type of a sound. And so therefore, that will give you some information. Sounds of percussion, timpani, these are the sounds or the names of the sounds that you produce when you percuss. Tympany and resonance, hyperresonance, dullness, and flatness. So tympany, what is tympany? Tympany is a loud, high-pitched drum-like tone of medium duration, characteristic of an organ that it is filled with air, that it is heard commonly over the gastric bubble and the stomach or over filled intestines. The gastric bubble is right above your umbilicus, and you will hear. Actually, tympany is heard over. It is considered normal. You will hear it all over the abdomen, but uh, it is more loud in the gastric bubble. Resonance is a loud, low-pitch, hollow tone of long duration. It is the normal finding of the lungs. So note that tympany is normal over all of the stomach. It is more loud, loud over the gastric bubble, and that is tympany, and that is normal. Gastric tympany is normal over most areas of the stomach. Resonance is loud, low pitch, hollow tone, or long duration, and that is normal findings over the lungs. How about hyperresonance? It is an abnormal, loud, low pitch tone of longer duration than resonance. It is heard when air becomes trapped and overinflates the lungs. It is often heard on the elderly. So even though this will be like an expected sound, so if you hear hyperresonance, it is usually, it means that if the air is trapped and is overinflated in the lungs, but usually elderly have that, so it is kind of an expected sound for them. That doesn't mean that it is normal, but usually they will have that. Dullness is a high-pitched tone that it is soft and short in duration, and it is usually heard over solid colon. So no dullness, no tympany, resonance. Where would you hear it?
Professor.
Yes.
So you said the first two, tympany and resonance, those are normal sounds, correct?
Normal. Tympany and resonance are normal sounds.
Got it.
Yes. You hear tympany more loudly over the gastric bubble, which is just above your umbilicus. That is the gastric bubble right in there. But hyperresonance is abnormal. And you will hear dullness when you are tapping, you are percussing a solid body organ such as the liver, or you are percussing like the left lower quadrant of the abdomen, and you feel like a mass there, and what it turns out, and you hear this dull sound, and what it might turn out to be is a stool-filled colon. That is the reason why you always ask when you are assessing the abdomen, when was your last bowel movement? Why? Because if you feel some mass and you hear this dull sound, you might think that the patient has a tumor. But what it is the patient has not gone to the bathroom in 3 or 4 days. Flatness is a high-pitched tone, very soft and very short, and of very short duration, and it occurs over solid tissues such as muscle or bone. Make sure that you know flatness. Like where would you hear flatness when you percuss? You will hear that over muscle or bone. These are the basic characteristics features of the sounds elicited by percussion, and that includes intensity and amplitude of sound, which refers to the softness or loudness of the sound. And this is nice to know, but so because you get a picture of what it means. pitch or frequency of the sound refers to the number of vibrations of sound per second. The slow vibrations produce low pitch sounds, whereas a high pitch sound comes from more rapid vibrations. And again, that is nice to know. Auscultating, we are on the last technique. When auscultating, one uses both the unassisted sense of a stethoscope. Body sounds that can be heard with the ears alone include a speech. You can hear when the patient is talking, when a patient is coughing. You can hear the respirations, especially if the patient is having respiratory distress, like, you can see that. You can hear it and see it. And percussion tones. You can hear that. If I percuss, you can hear it. You need the stethoscope whenever you are auscultating other parts of the body, like the breath sounds, the red sounds, the valves of the heart, the vowel sounds. A stethoscope works by blocking out other noises in the environment. Auscultating body sounds require a quiet environment in which the nurse can listen, not just for the presence or absence of sounds, but also the characteristic of each sound. Avoid auscultating over clothing, gowns, and sheets. So when you are doing a physical assessment, even though the patient is dressed, you need to go under the gown, from the top or from the bottom, depending what area. If you are going to test, let's say that you are going to auscultate the tones of the heart, but sometimes it's hard to do it. So you might have to expose that patient, that specific area that you are examining. When you are doing your physical assessment, because you are not doing it with real patients, you probably will utilize one of your relatives or friends, you are allowed to do it over their clothing. So they don't have to undress or anything. But in real life, when you go to the skills lab or to the skills lab or to the SIMS lab, you will be marked down if you auscultate over the patient's gowns or over clothing or sheets. So when you are auscultating, you have to avoid rubbing against patients' clothes or drapes, because then that will produce a different sound. Or you also should not touch the stethoscope, the tubing, because if you touch it, it will even hurt your ears if you do that. Movement of the stethoscope over thick or coarse hairs on the chest or back may alter or obscure sounds. Just that there are men, specifically men. Some men have a lot of chest hair, and also they have it in the back. And then once upon a time, what we did in order to, because we know that hair will obscure or obstruct the sounds, we will shave it. Excuse me. But through evidence base, we found out that doing that will create microscopic cuts, and the patient was more exposed for infection, which makes sense, right? Because the patient had tiny little cuts. And so it is no longer done that way. So the way that you have to do, you either wet the hair or trim it. You were provided in your black bag or blue bag, whatever you have, a bag with equipment, and they provided you with a specific or a special scissors, and that is the one that you will utilize to trim the hair or wet it, because that will help you hear better. Many sounds may be heard at the same time, so it is important to focus on one sound at a time whenever you are, specifically when you are trying to listen to the blood pressure. You have to really concentrate. Special equipment will help visualize, hear, and measure data during an assessment. Before beginning the physical assessment, the nurse should gather all the equipment, organize it, and place it within easy reach. So, in other words, if you are doing it, you already learned how to insert the Foley catheter. You know how difficult it is if you put your all your equipment so far away and you are already ready with your um, Foley catheter insertion, and you need to get the the syringe in order to test it, or whatever you are going to be doing, you will see that it is, if you don't have it within easy reach, it becomes more difficult, specifically if you are inserting an IV and you don't have your equipment right there and then, it becomes very, very difficult. So therefore, that's why one of the expectations and the practical is that you bring and have your equipment ready, um, easy to reach. Special equipment that may be used during a physical assessment include goniometer, no goniometer. In real life, you say, I never use it, and I work in the trenches for 26 years. My background is critical care. And then in the last 5 years, I did open heart. And so I never use the goniometer. But because in most hospitals have physical therapy, the goniometer is used to measure the degree of joint flexion and extension. And they have, let's say, a stroke, or they cannot move because of weakness. Or I'm pretty sure that did you go to a nursing home or a skilled nursing facility? Yes, you know how, uh, for one thing, most of the care is provided by not even CNS, but caregivers. But we cannot compare that or blame that them, because the nursing home is supposed to be like equal to your home, your own home. And so they don't require a lot of training or a lot of education, but they are overwhelmed with so many patients. Some caregivers have like 15 patients. You can imagine, some of them are incontinent, some of them cannot eat by themselves. So it is very difficult. So these these caregivers do not give range of motions. And if you don't do range of motions on a patient that it is semi-paralyzed because of a stroke or weakness, that arm or leg will literally kind of freeze. And when the patient comes to an acute hospital, and you try to extend the arm, you could even break it, because this arm, it is kind of frozen there because it has not been exercised. And so in order to find out how far you can extend the arm or the leg, you use the goniometer. But again, for purposes of the test, you will need to know what is the goniometer used for. In real life, you probably will never see one, because the physical assessment does the physical assessment. The physical therapist does this. Skin fold calipers, unless you work in a doctor's office, the skin calipers are used to measure the thickness of cutaneous tissue. Like, for instance, cosmetic clinics or doctor's offices, they will measure that, how much fat we have, usually around the abdomen or so. So that is like the lab handles, I think it is called. Uh, they will use the skin fold to find out how fat the person is. Know what is the transilluminator, and that detects blood, fluid, or masses in body cavities. So no goniometer and transilluminator. Special equipment that may be used during a physical assessment includes Woods lamps, not in the hospital setting, detects fungal infections in the skin, monofilament, not used in the hospital setting, um, assesses peripheral nerve sensation on the feet in a patient with diabetes or. So maybe the doctor who is a specialist on like internal medicine, and he takes care of diabetic patients. Diabetic patients, they always have neuropathy. And so they might use this equipment, which is called the monofilament. But nurses, generally, in the hospital, this equipment is not in there. So that is nice to know. A stethoscope. We are not going to go over all of this because you already know. You learned this on. We are going to go to break. Let's see, in 5 more minutes. So the stethoscope is used to auscultate body sounds such as blood pressure, heart sounds, respirations, and bowel sounds. The stethoscope has 3 parts, and you already know the binaurals, which are the earpieces, the flexible tubing at the end piece, and the end piece contains the diaphragm of the bell and the bell. But what you need to know, this is more or less the type of stethoscope that you are given in your bag. This is not very good stethoscope. It's kind of a cheap stethoscope, and you cannot hear very well. So whenever you can afford it, buy one stethoscope like this. This is a good stethoscope. Look at the difference of the tubing. How long is the tubing? What will allow you to hear better, a long tubing or a short tubing? What do you think, Karim? Will you hear better when you are auscultating the heart sounds with a long tubing or a short tubing?
Probably a short tubing.
Absolutely right. That is the correct answer. So if you have this long tubing, which is a cheap one, you can cut it. You can cut a piece and make it shorter. And whenever you can afford it, buy one of these stethoscopes. These are really good stethoscopes. It allows you to hear so much better. With this, boy, you really have to concentrate because it's too long. And look how narrow is the tubing versus this one. So make sure that you do that. Doppler. Know what is a Doppler? It is uses ultrasonic waves to detect sounds that are difficult to hear with a regular stethoscope. And it is usually used for to listen to ephemeral heart sounds and peripheral pulses that cannot be easily palpated. So for our purposes, we are not going to refer at all about the ephemeral heart sounds. But definitely, if you cannot normally know this, normally when you are doing a physical assessment, so this is not an equipment that you will have regularly with you whenever you are going to do a physical assessment. However, if you cannot feel the ephemeral pulses, you will have to get a Doppler, and you will have to mark it with a pen, a Sharpie or something, wherever you heard the ephemeral pulse. So the other person will go immediately there, or you yourself. You don't have to be looking all over the place. When using the Doppler to assess the pulse, turn it on, apply a small amount of gel at the end of the probe, and a transducer, and place the probe gently against the patient's skin over the artery to be auscultated. And this is an example. Of course, this is different from the one that you will be using on the foot to hear the ephemeral pulse, or any other area, any other artery that you cannot hear. Again, this is just nice to know. See how they use some type of a gel first. Then after that, they introduce the apparatus, and they will hear the sound as well. This is connected to a monitor, and they can also see. But again, for our purposes, that doesn't make us, it doesn't matter for us. It is the one that we use in order to do the peripheral pulses, whenever you cannot hear the peripheral pulses. Okay, so let's take a break. Come back at 9:20. Oh, all right. No, not 9:20. 9:10. 9:10. Oh my goodness. 9:10. Don't forget. Come back at 9:10.